Hold on, I'm sorry. It's supposed to say you're now recording. I'm going to go ahead and let people in about 10 minutes.
Okay.
Oh, excuse me, I'm looking at your computer screen. And I'm going to go ahead and let people in. So as soon as you hear after the announcement that it's starting, you can go ahead and start talking. Do you want to bring your
Perfect.
screen back up real quick?
I thought it was, but let me make sure.
It is. I can see it. I just don't see your PowerPoint. There we go. I can see it now. All right. So I'm going to allow people in. As soon as you hear the webinar has started, you can start talking.
Sounds good. Good afternoon, everyone, and welcome to the webinar. This is Susan Ryan, the Senior Director for the Greenhouse Project, and I'm really delighted to be here with you virtually, albeit I wish we were in person, but really excited to share a little bit about the Greenhouse Project's experience through the COVID-19, shall I say, nightmare that I think we've all experienced. Go to my next slide. There we go. So a little bit about myself. And for all of you who might be nurses out there, then I'm feeling already an affinity towards you. I am a nurse, and I have been a nurse so long that we actually wore nursing caps way back in the day when I was practicing nursing in a nursing home. I was a director of nursing for a 120-bed facility in the great state of Tennessee. And I will tell you that it was at a time when best practices were tying people up to keep them from falling or to keep them from eloping. And I did my very best as a nurse to be compliant and to do everything that we were told and supposed to do. In my heart of heart, I thought this just can't be right. And so when I got the opportunity to go into home care and to be a geriatric nurse educator, there is actually a grant-funded program from the Tennessee Valley Authority that really wanted to prevent institutionalization of elders. And I really resonated with everything that was about keeping people in their own homes and keeping them safe, keeping them experiencing great quality of life experiences, really having autonomy and choice and health and well-being. So I did that for years, and actually the grant ended, and then ultimately I would go back into long-term care, because I found that it was cost prohibitive or socially isolating to keep people in their own homes for an indefinite period of time. And so I went back into long-term care in 2001, and it really was with the idea that it's time to reform long-term care. And so I went on a journey to see what reformation would be. I joined a long-term care community, a CCRC. We had a nursing home there. I heard about the Greenhouse Project in 2005, went to Tupelo, Mississippi to see it. And in 2008, they were looking for a nurse to join the team, and I became that nurse. And I haven't looked back ever since. And I can't tell you the gratitude that I feel for being able to be a part of this. So here's kind of our agenda for today. This is what I'd like to talk about. Here we are, excuse me, here we are in a new decade. So let's talk about where we are now. Let's think about how in the world did we get here. I'll just touch briefly on the history of nursing homes and assisted living. There's a video link that Tara will send out to you after the presentation today when you get a copy of the recording. It's called Dare to Be Different, and it really does, it'll give you kind of a window into greenhouse homes and what we're doing. But then let's think about where we go from here. I'm going to share with you the COVID-19 data that has been captured in many of our greenhouse homes. So we're going to unpack that data for you. And then more than that, we're going to say, and why the good results. And we'll look at that data then through the lens of the greenhouse core values. we're going to talk a little bit about COVID-19 and normalcy. And I think if anything has become more apparent with the COVID crisis, it has been almost the crisis of social isolation that has occurred, and that lack of normalcy. And I'm sure you and I both could attest to the fact that we all have lost to some degree that normalcy, but especially elders in nursing homes, and you know what Greenhouse Homes have endeavored to do about it. And then I'm really making sure that saving some time for us to have some good conversations and questions that you might have. So let's think about where we are. And I don't know about you, but when I thought about that transition from 2019 to 2020, this graphic so depicts what I thought. I really felt like it was one of the biggest leaps I had ever made in my life. Probably maybe the Y2K crisis and going from 1999 to 2000 was a big deal. But 2019 to 2020, it really, really felt like quite the leap. So I don't know about you, but what was your vision? What did you think about 2020 as we were transitioning into a new decade? I know everybody makes New Year's resolutions, and so that wouldn't be surprising that personally, you know, maybe you're going to lose weight, maybe you'll exercise more, drink less, whatever it might be. We all make those personal resolutions. For me, 2020 just felt like I needed to have a bigger, more audacious personal goal. So there are a couple of things that I put on my list: trail running. I'm going to go back to rock climbing again. So those were kind of the big personal goals. Professionally speaking, though, the Greenhouse Project had some real high aspirations. We were planning a conference, our Greenhouse Annual Conference, to be held in Little Rock, Arkansas. And we chose Little Rock because we've got a brand new greenhouse community there. And we chose as our theme, Ready for Impact. And as we thought about a new decade filled with possibilities, filled with the promise of hopes and dreams, we thought we want this model to be ready for impact and to have impact. This is the decade we really want to see this model scale. Never would we have guessed that the novel coronavirus would hit. And I would say, you know, it just felt like that greenhouse model was ready for the impact of COVID-19. And I'll unpack that a little bit more in just a minute. You know, I think with the novel coronavirus, we have seen some sobering statistics, and these are likely not the most recent, but I can tell you that nursing homes confirmed cases have been up close to 200,000, and nursing home deaths getting close to 50,000. And 45% of all US deaths have occurred in nursing homes and assisted living. I know the media has certainly not been very kind to nursing homes, and they have referred to them as death pits and really just thought that they were kind of the tinderbox just ready for ignition when the first COVID case would roar through there. So how did we get here? And what is it about nursing homes and our systems that have gotten us to where we are and would have such incredible, those statistics being so sobering to us? So let's think about nursing homes. We have roughly 15,400. I hear different data points around how many we actually have across the country. When you think about when they were built just after Medicaid, Medicare came to be in the mid-60s. From 1966 to 1975, you can see there that there was a tremendous amount of growth. And they were really designed, modeled after the hospital. And the idea was that they really wanted to gain as much institutional efficiency as possible. They were building for economies of scale. You saw a huge upsurge in the number of private folks that were really getting into the nursing home business and really saw wow, what an incredible opportunity now that government is funding them. And as you can see from the pictures on your screen, there really was very little variation. I always call those two beds that are side by side, the reach out and touch your neighbor kind of a thing. And unless that's your husband, your partner, significant other, I'm not so sure that's exactly what I want for myself. And I think if you look at the hallway and the gentleman wheeling himself down the hallway, that does not evoke that sense of warmth or that sense of home or place that any of us would want to be. So you'll see a quote on the top of the slide that says, "Halfway houses between society and the cemetery for the elderly." This was a quote that was made by a US congressman when he saw what nursing homes were becoming. And this was uttered in 1979. So you can see that from this, there was a real cry for change. And older adults were certainly saying, and they still say, whatever happens, please don't send me to a nursing home. I've even heard, and I think there's research to support it, I'd rather die than go to a nursing home. And with the sobering statistics I made reference to earlier, you can understand why now especially this is becoming the sentiments of older adults. So you'll appreciate this was a Kaiser Family Foundation survey that was done in May 2005. And I went back to see if Kaiser had done anything beyond this. And they haven't done anything formally yet, but I will tell you that things have not gotten any better anecdotally. So you can see nurses get the highest rating, yay for us nurses. Doctors do a pretty good job. Hospitals, they come in kind of third from the top. Drug companies, not as much. Nursing homes, the only position, we do better than HMOs, and that's it. So obviously, the public perception of nursing homes has not been so great, which is why declining occupancy has been happening across those 15,000 plus nursing homes over the years. And I can tell you that with the COVID crisis, that occupancy is falling now. I have seen some numbers that many have fallen below 80%. So there's much that we need to do, and that cry for change is a loud, compelling cry. I really think that assisted living, which came to be late 70s, early 80s, I think Sunrise on the East Coast was kind of the big name, the big box assisted living. And it really was answering the cry for change, really wanting to shift the paradigm to really make it more consumer-centric as opposed to that institution-centric. And what does the consumer want? Well, it's about private rooms. It's about creating intentional community. It's about being able to achieve a sense of normalcy or routines that are individualized to the person. And bottom line is, don't we all want some autonomy and choice? Problem with assisted living is that they're a private pay model. And so if you've got the wherewithal to pay privately, then you're likely to find some better options. That having been said, the sobering statistics that I showed you, assisted living, many of those communities have not fared much better than nursing homes. So culture change in the US, and I will tell you that I believe that culture change really began with Oprah. And it really was kind of the consumer voice that was, waking up and saying something must be done. So in 1987, Oprah said that each individual should be able to achieve the highest practicable level of well-being, that was the goal for each individual living in a nursing home, and that it was time that we deinstitutionalize the nursing home. So by the 1990s, you had some culture change, reputable groups, the Pioneer Network, the Eden Alternative that came to be in the 90s. In 2007 then, Commonwealth Foundation did a survey and they discovered that 56% of those nursing homes were self-reporting that they were doing some culture change. In 2009 to 10, that number through another survey conducted was up to 85%. Nursing homes were self-reporting and stating that they were doing some culture change. In 2010, I believe this is where CMS and the Affordable Care Act, they came together, CMS writing interpretive guidelines to better understand how do we really create guidelines to really make sure we're achieving the goals of OBRA, that we are really seeking to see the person and really provide that highest practical level of well-being. In addition to that, there were mandates and incentives that would support culture change through the Affordable Care Act. In 2016, this is when CMS developed the person-centered care regulations. And so now we have regulations that are really designed to help us think differently and to help guide us as we really provide the care for those living in nursing homes. And of course, this is, your role and your job is to see those regulations are maintained. So what is culture change? And when you think about the principles, when people say that they are doing some sort of culture change, what are we talking about? And research has shown that the research that was conducted, the surveys, they were looking at 6 components. They were looking at the environment, and that environment was shifting to less institution, more home-like. They were looking at the care and the activities, and really instead of being kind of staff-centric or organization-centric, really centered on who the person is. They were looking at staff empowerment, and with that, more of a collaborative culture and a decentralization in management. And with that comes close relationships between staff and the elders or residents, but also between staff and family members. And last but not least was really wanting to make sure there was a continuous quality improvement, that there were processes in place to really monitor, manage quality, and to improve. Those were the components that these nursing homes, 56% in one study and 85% in another, that they were adhering to at least one or more of these components. But I will tell you that it wasn't until the greenhouse model did we really see radically disruptive innovation. And I can tell you in my career as a nurse, I've seen lots of different things. I have tried lots of different things in our traditional environments, but it wasn't until the greenhouse model made manifest with the first 4 homes that opened in Tupelo, Mississippi. I kind of say of all places, but who would have thought Tupelo, Mississippi, I always say birthplace of Elvis and birthplace of the greenhouse model. Those first 4 homes opening, I really believe created an incredible, I call it a radical ripple for change. It really showed the world what could be. And so what you see on this slide is the greenhouse model. This is a home, a greenhouse home in Rochester, New York. It is licensed as a skilled nursing facility. It's one of 2 homes that are embedded into a real neighborhood, a real community of other private homes. And I can tell you, I've been there many times. It's a beautiful home, and the normalcy and the quality of life experiences there are just powerful. So to just give you an idea of how the greenhouse model has spread, there are 300 greenhouse homes located in 32 states across the country. To give you an idea of who those greenhouse adopters are and what we know about them, 80% of them are licensed as skilled nursing. We have 18% that are licensed as assisted living. 2% are licensed as adult family care. That's a special designation in the state of Washington. And 82% nonprofits, 18% for-profits. And in terms of where they are, 37% are in rural locations, and 63% describe themselves as either suburban or urban. So there is a video that I really will want you to take a look at. Like I said, Tara will send out the link to the video so you can really take a look at the greenhouse model, and there are some great stats there for you to take a look at your leisure. So where do we go from here? Based on this virus hitting us so hard, where do we go from here, and what have we learned in this period of time? We're 9 months into 2020, and probably I'd say a good 6 months into the coronavirus challenges. So let's look at Greenhouse and the COVID-19 story. And I'm going to share a bit of the data and kind of the reason why we did what we did. So here's a little bit of the background into why we did what we did. Vince Moore, when COVID hit, he's from a researcher from Brown University. He reported a correlation and really talked about the size of the nursing home really mattered. And he's between COVID cases and the size of the nursing home. And that smaller homes were really experiencing a 2 to 3 times lower infection rate than large nursing homes. So that certainly kind of piqued our attention. I think in March, when COVID really started rearing its head from the West Coast and Kirkland, Washington, and then to New York, I tell you, I think providers everywhere were really buckling down. And similarly, greenhouse homes were doing the same. It was a time for them to really focus on the task at hand. And that was really keeping elders safe. And so for a while, we were hesitant to reach out and to see kind of what was going on. When this research came out, it did pique our attention and we wanted to learn more. In addition to that, we had so many folks from the media that were reaching out. I'm sure you probably saw the Death Pit story. And, you know, as the Robert Wood Johnson Foundation reached out and said, I've got to ask, how are greenhouse homes doing? And so we started reaching out, and it was more anecdotally, and I was finding so far so good, we're COVID-free. And that made me feel good, but it was a snapshot in time and did not really have the rigor or the methodology that I felt good as I was talking to media. So what we did was we reached out to our good friend and researcher, Cheryl Zimmerman. She's at University of North Carolina, and asked her if she would have interest in being our COVID research advisor. And would she work with us to develop a methodology to really unpack, to collect the data and then unpack what we are learning and do a bit of an analysis to see what can this data tell us. You know, I'm such a fan of the stories, and I will share many stories from greenhouse homes amid the COVID crisis. But I'm also a fan of data and the ability for data to really tell a compelling story. So let's get into some of the data that we've seen. So there's a lot on this slide, and I'm going to unpack it. We'll start at the left. So our sample size, as I told you, that there are 300 greenhouse homes representing 68 greenhouse organizations. I reached out to Otterbein Senior Life in Ohio. They have 10 small house organizations representing 47 small house homes. And so I thought we need to add to our sample size. And so we added to get actually it ended up being a total of 346 greenhouse plus small house homes. Those homes at Otterbein were built very similarly. Actually, the same architect that designed the Tupelo greenhouse homes designed the Otterbein homes. And so they were built very much size-wise. They are 10-person homes. And so and they had used much of the education and training, and their operational procedures were very similar to greenhouse. So it felt like the sample would be similar enough that it would really help to add to our data set. So all in, we're looking at roughly close to, well, about 3,727 elders. The next bullet I'm going to explain just a little bit, active and inactive organizations. Within Greenhouse, of those 300 homes, about 85% of them have remained actively engaged in the Greenhouse peer network. That means they stay connected to, they come to our conference, they're attending our webinars and special training. They have educators that are continuing to do the educator programs associated with greenhouse education. Those that are inactive, again, it's about 15%, and those are organizations that, for whatever reason, sometimes it was a sale of a community and it was purchased by an organization that opted not to stay part of Greenhouse. They had their own culture and they said thanks, but no thanks. We thought it would be important to reach out to all 300, that we really wanted to say whether you're active or inactive, we'd love to know how you're faring amid the pandemic. So a questionnaire was sent out. We kind of got our heads together in mid-May and we said, let's take a look at data collected, or excuse me, COVID confirmed cases between February 1st and May 31st. That was our first set of data we set out to capture. And so we sent a questionnaire out the beginning of June, and again, took a look at that data reporting from February 1st to May 31st. And then we wanted to say, and then let's look monthly, June, July, August, September, and October. Let's go through October, because as organizations, cities, states started to open up, we wanted to see what might happen to impact the occurrence of COVID cases. So this is the graph on the side, the pie chart. You'll see this is kind of who responded. We had an 84% response rate among greenhouse communities. What you're seeing are just greenhouse responses. And you'll see the skilled nursing folks represent 229 skilled nursing greenhouse homes, assisted living, 24 assisted living greenhouse homes, and then the 3 adult family care that I had talked about. So I'm going to go into a little bit about, let's break it down a little bit more. And here's where we combined our small house and greenhouse. So in this first swath of data, we were looking at these 229 homes, and we found 11 of those 229 homes had positive cases. The number of cases in those 11 homes, a total of 32 elders had confirmed COVID-19 positive cases. Of the greenhouse skilled nursing homes, there was 1 COVID-related death. So 95% of the 229 homes reported COVID-free. We added the small house homes. They had 10 homes once again, and 7 of those 10 had positive cases, and 15 elders within the 7 homes had positive cases, and they had 3 elders that had a COVID-related death. Greenhouse and small house combined, you can see kind of a total of 4 deaths, 47 cases, and overall 93.4% of 276 homes were COVID-free. Taking a look at assisted living, and again, assisted living, these are our greenhouse homes, but 2 of the homes had represented 15 elders with cases and 3 deaths. In the month of June, June was a good month for everybody. You can see that among greenhouse homes, we had less of a response rate, but of those 199 homes that responded, 98.5% were COVID-free. There were 5 confirmed COVID cases for elders in 3 homes. And when you look at the small house, they were 100% COVID-free for the month of June. Assisted living was also 100%, and family care 100%. Going into July, it's interesting because we were collecting July data, of course, the first week in August. So when you think about what might have happened in July, we of course had the July 4th holiday. This is where I think summer was starting to happen. These are my thoughts. This is not the researcher speaking, but it's interesting to me that we had 10 homes with positive cases and 17 elders testing positive. No deaths for greenhouse homes, 247 homes reporting. In the small house, you'll see that they had 3 homes with cases representing 11 elders, and again, they had 3 deaths there. Assisted living, they had 2 houses with 6 cases, and again, 1 death there. Family care has done well all the way throughout. So this next slide, I'm going to show, people have asked, okay, this is great, but where were the homes located? And this is the analysis that we have been working with our friends at UNC to really unpack. And it was important for us to compare the mean number of COVID cases per 1,000 resident days between greenhouse and small house and the CMS COVID-19 database. And what we wanted to do was look at greenhouse in comparison to their state level, and then greenhouse to the county level, and then greenhouse drilling it down a little bit more to the city level. And so what you can see here, the different colors, greenhouse is green, CMS data for the state is red, CMS for the county is blue, and CMS for the city is purple. So what you can see here is that the rates of COVID-19 cases for elders were significantly less in greenhouse small house at the state, county, and city level. The p-value is less than 0.05. I'm not a researcher, but that says a lot. And here's mortality, which I think is equally important. Once again, our CMS data for the state is red, for the county is blue, and for the city is purple. And again, they were looking at the COVID-19 mortality per 1,000 positive COVID-19 infections between the greenhouse and the COVID-19. And the mortality rates for elders were significantly less in greenhouse small house at the state, county, and city level. And the p-value here is less than 0.01. So you look at that, and when you just think about this, I mean, it says so much. So what can we learn from this, and where do we go from here? I think, as I mentioned when I first started, it's really important to kind of look at, so what in the world would it be about greenhouse homes that would make that data so significant in terms of confirmed cases and in terms of mortality rates? And is there something about this model that really is a model that we should be wanting to emulate? And so let's unpack it and let's take a look at the core values. You'll see the 3 core values: real home, meaningful life, and empowered staff. And we're with the one that I think everybody is most familiar with, and that is real home. That is the physical environment. And once again, Tara's going to send you a link to a virtual home tour where you're able to kind of go in and see the beautiful greenhouse homes at St. Elizabeth's Home in Rhode Island. They've got 4 beautiful greenhouse homes. And the picture that I'm showing you now, this is the front door to one of the 12 homes at John Knox Village in Pompano Beach, Florida. So what do you notice about this, and what is significant about the door? Well, real home has a real door. It's a design element that is not just indicating that this is a home, a real home for, in this case, 12 people, but it really says something about who has permission to come and go into that home. It's not just an open corridor where so many people are coming and going. The entrance is significant in terms of who's coming and who's going in that home. Here is the hearth area. We call it the heart of the home. This is from Longmont, Colorado. There were 4 greenhouse homes that were built in Longmont, Colorado. These are homes from the grand opening celebration that I attended last August. And once again, as you can see, there's something that just invites you into a real home. I've actually used this as my virtual background when I'm on Zoom calls. And people have had more comments about my beautiful living room until they see the exit sign. And then they realize, oh, that's probably not her home. And I don't have an exit sign in my house, but I would love to have this hearth. In addition to that, think about some of the other places and spaces that really signal home and health and well-being. Think about the front porch. The front porch is the one on the left. And at Hover, this is a place where residents are able to sit outside and get the fresh air if they'd like. It's a secured, safe place for them to just get that breath of fresh air, to have a snack out there, to really spend some time with a person. You'll see in the lower right is the open kitchen. I want you to think about nutrition and hydration and how important it was to be able to have that during COVID. Think about real home and meals being prepared and served in a greenhouse home. That means there's no central kitchen. There are no dietary trays that are coming and going in and out of a greenhouse home. Everything is prepared within that kitchen that is servicing, this is John Knox Village, 12 people living in that home. Take a look at the open concept kitchen and the opportunity from a visual sight perspective for whomever is cooking in the home to be able to see elders moving about the home. In addition to that, Real Home has a dining room table. And I just think about where my family, where we had our meals growing up, whether it was as a kid or with my children and now my grandchildren. How much do I appreciate having a table, one table where we all sit together and we really share what we call convivium, good food and good company, and really have that sense of community. Real Home means for elders, they have a private room. When you think about COVID-19, when you think about infection and spread of infection and trying to mitigate the spread of infection, how important was a private room to helping mitigate that spread and to really make sure that we were doing our very best to have elders safe and secure in a private room. Private bath. Each one of those private bedrooms has their own private bath and roll-in shower. So all of their bathing needs where it's not a central area, but it's all done right there. In addition, there's no centralized laundry. Laundry is done in that greenhouse home. So each resident's laundry was able to be done in the laundry room right there in the house and done one at a time. I think this is my favorite, and I think if I were to need long-term care, it would be of paramount importance for me to be able to get outside. And in the greenhouse home, that is part of the philosophy of Real Home, and that is having access to outdoors. Once again, this is St. John's. These are the two homes. They kind of back up to one another, so they do share an enclosed courtyard. You'll see the gazebo there. To the lower left, you'll see what's the beginning of a raised garden bed. Kind of a pergola there that does offer some shaded areas, and there is actually a screened area. If you look beyond the gazebo, you'll see a bit of a screened area. So think just for a moment about some of those design elements that you just saw. Think about the private rooms. Think about the private bathrooms, the decentralized laundry, the decentralized dietary departments, and even housekeeping has been decentralized. And they've got housekeeping closets right there in each home so that each home can be cleaned. And how important that is to really achieving health and well-being. But it's not just the physical environment. So let's take a look at the next core value, and I'm going to unpack meaningful life for you. Meaningful life occurs best in a real home setting. So building upon the Real Home design elements that you just saw. But I will tell you, a meaningful life does not happen unless there are deep, knowing relationships. And oftentimes when I sum up meaningful life, I say it's about relationship-rich, elder-directed living. that nobody wants to be defined by their care needs, albeit those are important. But it really is about places where people should come to live, and they should come to live a meaningful and a purposeful life. I think having that sense of community. So when COVID first broke and the weather was just starting to get warm, this happens to be Arkansas, they all wanted to get outside, and that's what they did. They all went outside, and that front porch was large enough that they all got to be outside and sit together. And they did wear their mask, but they were able to get outside. And actually, this is a neighborhood of 11 homes, actually. And so it's in like a real neighborhood, like a cul-de-sac. And so they were able to see their neighbors on the other side of the street. Kind of reminds me of, we had a kind of a neighborhood thing where we sat on our decks, actually. We're able to speak to our neighbors in the adjacent deck. So that's normalcy. In addition to that, the outdoor opportunities that were afforded, that easy access to outside. These are little picnics and things that happened. This happens to be at Hover Community in Longmont, Colorado. And you can see that socially distant and really enjoying the outdoors was important to elders. Purposeful living. And, having a meaningful life means that it's not just doing mundane things, but you're connected to a purpose. You're connected to things that are important to you. And it really doesn't matter your cognition. This isn't about how we support elders living with dementia. That's a whole other webinar, and I'd love to do that at some point. But really understanding who that person is, which is why those relationships are so important. This is a little lady who in Arkansas, she really loved to be in the kitchen. And so she donned her hairnet, and she would be in the kitchen while they were preparing some of the meals. And it was purposeful, and she was able to talk to them as they were preparing food. I think this is a special story. This is an elder that is living with some dementia, some significant dementia, and very active. And with COVID, it was really hard for her to really understand everything that was going on. Here's the deal. Through those deep knowing relationships, they really discovered that this woman had been a homemaker all her life. She loved nothing more than to bake cakes. And so that's what they let her do. And she would get into the kitchen and she would bake a cake and do what she did best. In addition to that, she really felt it was her responsibility to kind of contribute to the life of the home. And at the evening, she said, I need to just sweep off the front porch. And so she would go out every evening and want to contribute to the life of the home by finding that purpose, that meaning for her, not for everybody, but for her, it was meaningful and it was purposeful. Gardening. I was surprised to find out how many gardens were growing across Greenhouse Homes. So you'll see 3 different communities up there on the slides there, the pictures. In addition to that, there are a couple other gentlemen, and it's really interesting. The gentleman on the left, he was a farmer, and he really lives with some significant dementia, and he was really becoming a little bit stir crazy, probably like all of us were amid the pandemic, and missing the family visitation and so forth. Well, what they discovered is how much joy he had playing in the dirt. And when I say playing, creating an incredible garden. And the gentleman on the right, he has some functional issues with his left hand, but he was able to kind of till up the soil and get it ready for planting. Both men enjoying meaningful and purposeful lives. I think another thing that's really important, especially amid a pandemic, and meaningful life happens when we stay connected to one another. And so we'll talk about staffing later, but how important it was for these elders to communicate to their families. And so these were Shabazim, the direct care staff, the CNAs that are specially trained, and really communicating that message taking a picture and then sending it to their families. And what were the words of wisdom? And what was the message for the family? And so you can see those there. Window visits. When window visits were allowable, then they, brought pets to see them in the windows. And what you can see, there's these are two different elder rooms, same house. But what was interesting is that what worked for a window visit for one elder, this was her pet, also worked for another elder who said, bring it to my window too. So you got a kind of a big bang for your buck here. But how much more important to be able to have a real pet in a real home. And this again is one of the communities in Paragould, Arkansas, one of the homes there. And they have a dog that they adopted when, this is Miles, and Miles was a puppy. When one of the CNAs brought it in to see the elders, she had a whole litter of them, and Miles was the runt of the litter. And they all determined and voted that they wanted Miles to stay with them. And it was an interesting care plan process, and that's a whole other story. It's a beautiful story about what was done to really ensure that Miles could live with the elders and that everybody could live safely. But the quality of life that Miles has brought, especially during COVID, that sense of normalcy, that sense of connection, that sense of meaning and purpose has been incredible. And the stories that have emerged about residents that were living there that, well, let's just say people would describe them as those residents had behaviors, and what Miles did in terms of giving them a purpose. And, the ability to give Miles treats, to be able to let Miles out in the backyard has been just a real game changer for this community. Mother's Day happened amid a quarantine, but that didn't stop families, and it didn't stop elders from really making sure they were connected. So there was a Mother's Day parade. This happens to be in Tupelo, Mississippi. And not only did families create the signs, but the direct care staff helped elders create signs. And so they were protected here as family members drove by, and they shared the love and shared their messages through those signs. I love this story, and I think this is probably one of the most creative ways that greenhouse communities created a sense of normalcy. We've all heard of a barbecue. Have you ever heard or thought about doing a quarantine? Well, that's what one of the homes in Tupelo, Mississippi did. And what they decided to do is they were going to barbecue, and they were going to figure out how they were going to do it safely. And that's what they did. They fired up the grill. They invited family members who were on the perimeter of the courtyard, socially distant, and elders socially distant. And they had their quarantine, and they were able to see one another. They were able to feel a connection with one another, even amid quarantine. Here's another celebrating milestones, and this was a couple that were celebrating an anniversary. And what a beautiful backyard to be able to do it. And you can't let these special moments pass, even if you are in quarantine. But think about the opportunity that a greenhouse community, that easy access to outside, the beautiful gardens that are out there, and the ability for the two of them to have private dining in a garden setting. I'm talking about the power of normal and how important it is for us to really normalize our programs, normalize our environments, so that we really see people first before we see the labels of their disease or the labels of what they cannot do. Let's know people as individuals. This is a lady living with rather significant cognitive decline. This is her room in a greenhouse home. And when you just look at her, you see a woman first enjoying some things that are important to her and having things in her room that really define who she is. She's not sharing the space with somebody else, but she has her space, and it's her space that she's able to be who she is and to have that sense of normalcy even within her own room. Once again, I can't stress enough, to have a meaningful life, you really have to be in deep knowing relationships. You can't support somebody you don't really know or don't fully understand. And we'll talk more about that when we talk about staffing. I think this was a sweet picture that one of our greenhouse communities sent. And this CNA, Shabazz, that was working with an elder in the home, was so proud to share her baby's birthday with the elder. And, they become like family. And I think, as family visitations shut down, these CNAs, these Shabazim, really became like family. And they had their own sense of familial relationships, and were able to make connections as well. And so, thank God for cell phones, and they were able to really just kind of share some of those moments. Relationships matter to our health and well-being. As humans, we are wired to be connected. We need that social connectedness. It is so important. And I think, to contrast that with the social isolation that has occurred during the COVID pandemic has been super challenging, and I think will require that level of creativity and rethinking some of our environments and what we can do, but certainly philosophically, really understanding what's important. Last but not least is the empowered staff. And I think, this is often the core value that gets minimized. It's not talked about as much. We see the physical environment, so real home makes sense. And philosophically, for meaningful life, that makes sense. It kind of fits with person-centered care, person-directed living. Empowered staff, what does that mean? And how do you really get there? So philosophically, fundamentally, greenhouse, one word, is about growing plants and producing optimal growth in those plants. Greenhouse, two words, is really about growing people and really bringing out the best and the optimal growth in people. And I say empowerment does not happen without wise leadership. It really, and we have seen this time and time again among greenhouse homes, that empowered staff really is a function of leadership. So here's a typical organizational chart, and you'll see the administrator is typically at the top, CNAs are at the bottom, and you've got layers and layers, chains of command, or whatever you might want to refer to it as. But in greenhouse, it really is completely changed. There is no hierarchy. It really is concentric circles. And you'll see in this chart that the elder is really at the very center. I always say the world revolves around the elder, and that elder is surrounded by the direct care staff. They function as a self-managed work team, and they are there to really nurture, protect, and sustain those elders. They are there to be in consistent, deep, knowing relationships. So that means there's no rotating of staff, but it really is whoever's working in a home, they're working in that home and not floating from one home to the other. But they don't work absent of management or support. They are supported by a clinical support team. And those are folks that are working in collaborative care partnerships with the self-managed work team. So it really requires a radical change in leadership, and it really moves to a coaching style, and decisions are made in more of a participative fashion. Empower teams. I can't say enough about how to really gain efficiency through staff empowerment and the team concept. And so much of our education is really focused on how you build those teams. Some more pictures of empowered staff. And I want to just take a moment to really talk about the power of consistent staffing, because I think what we've learned from COVID is that the fewer interactions, the fewer people coming and going, the less chance that you're going to bring COVID into the home. And we do know that COVID has come in through asymptomatic transmission. No home, yours or mine, or a greenhouse home, no home is impenetrable to COVID-19. And as long as there are people in that home that are coming and going, in a greenhouse home, that would be staff, then we run the risk of somebody picking it up and bringing it in. How important is it to have the same people that are coming and going? And not just for that reason, but think about the reason for deep knowing relationships. I told you how important deep knowing relationships were to really supporting good outcomes and really early detection. When you think about the first sign of a COVID illness, if you were able to act then, instead of noticing it much later when that person may need a transfer to a hospital, but really seeing it earlier and catching it earlier. The nutrition hydration that I was talking about, knowing what a person wants. If they didn't eat so much at lunch, well, what do we have in the kitchen that's right there that we can support this elder to be able to meet their nutrition and hydration needs? And so really watching that and consistent staffing, they know when somebody is just not themselves because they're in relationship with that person, because they're there day to day. I love both of these pictures. The ones on the top left, it really was Shabazz who was expecting a baby, and the elder was just so fascinated with watching her tummy grow. And the other one on the right, once again, this is in Arkansas, and a farmer. This elder had been a farmer, and when he saw the tractors roaring in the backyard beyond the greenhouse community, he just needed to go outside. And that's what the Shabazz, the CNA, did, took him outside to watch the tractors. Versatile workers, I love this. So once again, you know, the fewer people that are coming and going, the better. So working as a versatile worker, having more than a care role, but you are cooking, you are doing cleaning, you are doing laundry. And I think this is interesting, and perhaps some caulking if you need to caulk. I guess there are some places that women know exactly what to do with a caulking gun. But nevertheless, it's not bringing the maintenance man in. It's not bringing a separate cook in or trays from a centralized kitchen. It's doing everything within that home. And that, again, reduces the chance of more people potentially bringing in the virus. I think the other thing wise leaders do is they really take good care of their team. This happens to be a Jewish home family. And while not a greenhouse, I was just so struck by what they did to really take care of their teams and continue to do to take care of their teams, from giving staff haircuts to serving all sorts of incredible meals for them, to having a little bodega. They actually set up a little store where the staff were able to purchase the essentials such as toilet paper and some of those things, so they wouldn't have to go by a grocery store on their way home. That's creative thinking, and that's wise leadership, and that makes for an empowered staff that you're more likely to retain. These are just some other ways that some of our communities took care of their folks. You'll see the ladies on the left, they are holding little thank you gift baskets, little gift wraps, I should say. And then an elder at one of the independent living just really reached out with a sign and said, we're just so grateful for what you're doing. In addition to this was the director of HR who really put on her mask and just wanted to do her own parade to let the workers know how much she appreciated what the staff were doing. And you know what I thought was really interesting? She recalled to me, she said, you know, John Knox Village became known as the safe place to work. And when they were trying to really make sure they had enough staff, word got out that that's where you should go. They don't have any COVID cases, and they really make sure that you have what you need to be safe. And moving on, this is an elder in one of the greenhouse homes, and essentially, you know, wanted to give her own message. So there you have it. I like this sentiment from a Shabazz. Don't worry, I got this. I'm a Shabazz, and your loved ones are being taken care of. And that was her sentiment that she sent out to family members in that home. How nice to receive something from a care partner that as a family member you've had relationship with, and you know that person. And when she's sending that out to you, you're feeling a sense of confidence and calm that your loved one is being well cared for. So here's what I want to just do a couple slides to wrap it up. We're not just a small house movement. Everybody focuses on that. And I would say in a COVID time, I would say that's pretty darn important. But this is more than that. It's a movement to deinstitutionalize, destigmatize, and humanize care for all people so that they live meaningful and purposeful lives. And when I say all people, it's not just elders or residents, it's the staff as well. That we believe this is about growing people and really helping everyone experience better quality of life experiences. Here's one educational frame construct that we use. We have discovered that beliefs, behaviors, and systems are important, is an important construct. So when you think about long-term care, when you think about culture change, oftentimes, and I've been in this culture change space for many, many years, and you typically always focus on what are the behaviors that need to change. And so everybody focuses on behaviors, and it ends up being more of a quick fix behavior that many times is not sustained over time. What we have learned is that we need to shift our mindsets. We need to shift our beliefs, and we need to identify some of the traditional beliefs and mindsets that have continued to perpetuate a traditional model. And how do we shift our mindset and our approaches to bring a more quality of life, that model that really brings social connectedness, that really sees elders as individuals that have intrinsic worth and opportunity for growth. And then those beliefs will inform the behaviors, and we need to identify the systems. You can't have new beliefs, behaviors in a traditional system. And so what are those organizational systems and practices that need to change in order to support the new beliefs and behaviors? It's a process. This construct is woven through all of our education, and it is something we do a lot of education on. So when I said Greenhouse, our conference was ready for impact, I kind of closed with, and I believe they were made for this moment in time. And I think the data really helps to share a rather compelling story into the power of this model. So with that, I'm going to just open it up for questions to see if there are any questions.
Susan, there are no questions as of right now. Nothing in chat.
Okay. Well, I have one more slide. I mean, I'm happy to, and I think I have my contact information, and you certainly have it. I want to introduce you to a podcast. It's called Elevate Elder Care, and I have had some of the most fascinating conversation with diverse leaders, thought leaders, researchers. Many of you may know Dr. David Grabowski. I interviewed him to get his take on COVID-19 and what his research has shown. I have interviewed Lori Smetanka with Consumer Voice to really get her thoughts on what her opinions might be. I have talked to greenhouse providers. I have talked to traditional nursing home providers. Those leaders, Carol Silver Elliott from A Jewish Home Family being one of them, those leaders that even within a more traditional structure even did some amazing things to mitigate the spread of the infection. So you'll find this on Apple, Stitcher, Spotify. So wherever you're looking for podcasts, if you want a good podcast, I would recommend that. You know, we really do. I think all of us at the core of our being would like to see us elevate elder care and certainly get to a place where we are not always subject to some of the devastation that we've seen in nursing homes so far.
Susan, I do have two questions. The first
Sure.
one is can you share the cost for the greenhouse model?
The cost in terms to live there or the cost to build?
So it doesn't specify what is the cost.
Let's do
Is the
both.
cost more for the greenhouse model? I'm sorry.
Yeah, I thought that might be the question. So the majority of greenhouse homes are licensed as Medicaid and Medicare. I did a survey in 2017 and discovered that 42% of those living in greenhouse homes were funded by Medicaid. So not quite half were there. And, you know, as I say, it may cost a bit more to build. It should not cost more to operate. But you really do gain some efficiencies through those deep knowing relationships. If you can keep staff longer, less turnover, if you can do early detection and avoid some of the associated supply cost, think about food cost and how you might be able to control food costs. So your operating costs should be about the same from a traditional to a greenhouse community. You know, I think what you build, where you build, those are some of the determinants of what it would cost to build. And we are finding it is rather variable. Are you in Boston or are you in Arkansas or Alaska? And each of those places, you know, have very, very different development costs. How you finance your home is also important, where you're able to find good financing terms. Many of ours greenhouse adopters are not-for-profit, so they've done some nice capital campaigns as well. But, you know, we do have a contingent of for-profits. We have a for-profit provider in Arkansas who will open this year his 5th greenhouse campus. And he has 34 greenhouse homes over 4 campuses now, and his 5th will add another 9. So he obviously has figured out how to make this work. And I believe it can be done and is being done.
So Susan, the question was in reference to the cost for resident care.
Good question. So a cost, I'll give you an example. The cost in we did a case study on a greenhouse community, and they had 455 bed traditional nursing home, and they had a 20 bed, 2 10-bed greenhouse homes. And they had operating cost in their traditional building were $300 per resident per day. And in the greenhouse home, it was $215. So far less. And, you know, when they talked about it, it really was around, the biggest difference was supplement usage. They were spending $150,000 in the traditional building for supplements, and in the greenhouse home, they were able to just use real foods and things that they already had in their cupboards, refrigerator, whatever it might be that supported the elder.
Thank you, Susan. So an additional question is, and I believe you touched on this, are there any homes that are greenhouse that are funded by Medicaid or Medicare?
Yeah, and like I said, you know, we work really hard. This should not be a model that if you have the wherewithal to pay for it, you got it. We believe that we need to enable it to fit within our current reimbursement structures. And I think probably those on the call today are well aware that some states Medicaid reimbursement is better than others. So there are some states that are a little more challenged to do that. But, you know, we work hard to make sure that this does fit within Medicaid.
Okay, and the final question is, are hospice services provided on site? And if so, are the services provided by general healthcare practitioners, or do you arrange for hospice services?
Yeah, that's a good question. And, you know, typically what I'm finding is that families really decline the hospice benefit. They really don't want to bring somebody in that's new, where they haven't had a relationship. They feel that hospice care can be provided by the staff within the greenhouse home And so many times that's kind of what they do. So in our education and training, we do some work around palliative care and hospice care. And then each organization really makes sure that they're doing everything possible to ensure that they're able to meet the needs of a person that is dying in a greenhouse home.
Okay, another question just came in. It is, are there any Medicaid and Medicare greenhouse facilities in Texas?
So there are two communities that I would say San Angelo, it was part of the Buckner retirement communities. They used to be Baptist homes. So they are inactive homes right now. Buckner kind of determined that they had kind of the Buckner culture and were trying to do some things. We are actively engaged with a provider in San Antonio, Texas, to build 4 greenhouse homes. And he is determined, and his board is determined, to make them fit within Texas Medicaid reimbursement.
So those are all the questions I received. Of course, if there are any other questions after the webinar, you can send them to contact@afsa.org, and I will forward them along to Susan. Susan, was there anything else that you wanted to add?
No, thank you so much for the opportunity. I really enjoyed being a part of your little webinar series, and again, happy to take any questions at a later time.
Thank you, Susan. Everyone is saying thank you so much for this webinar. It was very informative, and AFSA thanks you as well. And this webinar has been recorded and will be available on the AFSA website. Go ahead, Susan. I'm sorry.
No, that's okay. I'm just going to say goodbye. So thanks so much. All right.
Bye-bye.
Bye.